Happy Saturday, guys, right? Or in my words, when it gets to be Thursday, it's like happy pre-Sunday fun day, right? Aren't we all looking for that? Okay, so I have to tell you guys a story. You know, you saw that Trevor got my bio, kind of like, hey, let me sneak this to you. In case you guys forgot, I was the alternate, right? I'm the alternate girl. So when I have been stalking this competition for the longest time, and as you know, it's terrifying to come up here. I'm like, I'm gonna do it, I'm not gonna do it. And then I was like, I'm gonna do it. So I put in an application. They said, hey, Rach, we got our 50 people, but you can be an alternate. And I'm thinking, this is an awesome stage. All those 50 people are gonna show up. You know they will. And then I got the call last Friday. You know what? You can have a spot. Well, I had all these ideas swirling around in my head about what I'm gonna talk about today. And so I was like, I can put this together. I worked hard last weekend. Y'all, I put it all together. And then I thought on Sunday, I should maybe go back and look at my original submission. Would it fit what I just put together? Well, no, it did not. So all that work was for naught. And I said, well, I got all this stuff. I'm gonna put it together. It's gonna fit my little box really well. And then I was on the plane because, you know, I was busy on Monday and Tuesday. I had to pack, I had to shop. I mean, I had to find something to wear. So then on the plane, I write my next one. And then I'm good, I think it's great, I'm fine, I'm practicing. And then yesterday, I don't know about you guys, you know how your cat eats your homework or your dog? My computer ate my homework. So all my homework was gone. So then I'm back to the drawing board again yesterday. Now listen, all my ideas are still there. I just had to share that story with you because that's not something you can make up. So I want to start off by saying flashback 1976. And no, we're not going to talk about the bicentennial. I was in 4th grade. I was excited. I'm going to gym class. Doesn't everybody love to go to gym class when they're in elementary school? Because when you're that age, man, you got to get the wiggles out. So we're walking down the hall, and I can't wait, and I go in there, and there's this giant circle. And I'm thinking, duck, duck, goose. Are we going to play Ring Around the Rosie? What's going on here? No. He has all of us sit in a circle, crisscross applesauce. And we're going to play my first experience with telephone. Any of you all played telephone? Of course you have. So, gym teacher whispers a small phrase in one student's ear, and then they pass it all the way around. You following me? So now when we get to that last student, we should have the same phrase. It should be simple, right? Well, guess what? It wasn't that simple. And I was like, is this a fluke? Well, we did it 3 more times, and it never worked, but it was lots of giggles, and it was lots of fun. That was my first experience of what you say and what someone hears. So the art of empathic listening was already taught to me at the ripe age of 9. So then I graduated dental hygiene school in 1988, and I hope you guys are doing the math so you can figure out how old I am, okay? So let's just do that. Yeah, there you go. So I am so excited because I have had traditional education on how to communicate. And I've learned a whole bunch of new stuff. And I bet all of you who work in dentistry have as well. You know all the words, right? The mesial, the distal, the buccal, the lingual, the dentin, cementum, hemorrhage, and my very favorite one, suppuration. I mean, who could make pus sound so sexy? Right? So I'm going to use all these words because they're going to give me cred with my patients. They're going to take me seriously because I know all these great words. So I launch out into my career, and then the other thing all my instructors told me, they said, now, dentistry is kind of this thing, and you don't want to make your patients feel bad. So treat them with kid gloves. Just be really nice to them. You don't want to offend them. So I'm thinking in my mind, if I'm sitting chairside and I don't want to offend my patients, then probably I don't want to tell them what's really going on. So maybe if I add a little minimalization, it'll make it easier. Like, patient, you have a little bit of bleeding. Or patient, you have a little crack in your tooth. Well, as you all know, if you've been practicing, that put me back in that I'm a job guy, okay? I'm a tooth janitor, I give up. But then I'm like, I got a lot of years I got to do this. What am I going to do? What I did was learn different ways to speak to my patients, and that's what I want to share with you today. Now listen, for the last 2 days, we've had amazing speakers up here. It has been my great pleasure to share the stage with. And everyone has so much to give to us as far as how can we be better clinicians Monday? How can I get some joy back in the op, right? So with that, I want you all my dental professionals, I want you to close your eyes. I am going to rebrand you today. I'm going to give you a new title. No longer are you spit suckers and tooth flicking pickers, as my girl would say. What you are head and neck healthcare providers, okay? That's what you are. You have everything to do with your patient's overall health, and I want you to own it and love it. Okay? So as we go forward, I am going to go in with some new vigor. So with technology, where we have been today, we know that we have a less amount of time to get what we need to across to our patients. So I want to help you with 3 concepts that I think will help me, that opened up the world to me, got me out of that weird place of selling to my patients or telling them what to do. So the first key concept is patient comes in, and with your nonverbal communication, humanize them. You want to knee to knee them. Don't stand behind them as their blood pressure is going. I want you to say, now listen, I do a lot of fill-in hygiene, so patients already meet me like this. Where's my hygienist? And I said, I'm right here, your hygienist. And I do also let them know, I'm Rachel and I'm going to take great care of you today. So we level set there, and then I'm going to use technology. Thank goodness we have technology of digital photography. Digital photography is my passion because it shows the whole mouth, not tooth to tooth. So we use that. We use the intraoral scanner, which Val already talked about. Those things to me are then I collect that and I tell my patient, I'm looking for the 3 ways that you are at risk of losing your teeth today. One is infection of bacteria that causes cavities. The second is bacteria that causes bone and gum disease, because the bone leaves too. And the third way is how your teeth fit together. With our assessments, I'm going to ask you something. So I will look at that and say, patient, will you please share with me what you see? When they do that, guess what? I've engaged them in their co-discovery. No longer am I telling them what I see. I'm asking them to tell me what they see. Then the most important thing I want you to do next after that absolutely changed my life, is I want you to ask permission. Permission to be part of their journey. Patient, with your permission, can I share with you what I see? Because then they're engaged with me, they own it, they want it, and then we can talk about their solutions. And then when we do find things that are not perfect in their mouth, I want you to lose your dental degree. We've talked about that. We've had some great speakers who've already touched on that. I want you, when you see a crack in a tooth, patient, it's like a crack in a windshield, bring it into where they are. If you have muscle pain or jaw issues, it's like a porch swing that has chains that are not even. If you wear a denture, it's like running a marathon in flip-flops, right? So all these things, these patients can actually start believing you and being part of that journey. That has been the most difficult thing for me as far as patient communication, is helping my patients know and love what I'm doing for them, and I'm not talking at them and telling them what to do. So if anything I can give you today, please go with your patients on Monday. The next time you see a patient, treat them, humanize them, talk to them like a human. Use your technology to bring them through that co-discovery process, and then you can get that joy back in the op. Thank you so much. Yeah!